Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before today's update, I want to remind anyone who tests positive for COVID-19 that it is important to call your family doctor once you receive your results. In addition to being well-versed in COVID-19, your family physician is most familiar with your health. They are in the best position to provide medical support and follow-up after a diagnosis. They can and will help to look after you to the best of their abilities. There are options for virtual appointments, so your doctor can support you without you needing to go in person. Of course, if you have a life-threatening or emergency situation, please don't hesitate to call 911 for immediate assistance. Be sure to let the operator know that you've tested positive for COVID-19 so the appropriate precautions can be taken while providing medical care. For today's update, over the last 24 hours, we have identified 1,307 additional cases of COVID-19 in Alberta. Yesterday, we completed more than 15,800 new tests. Our provincial positivity rate currently sits at about 8.4%, and we now have 16,628 active cases. There are 479 people in hospital, including 97 who have been admitted to the ICU. Sadly, there were 10 more deaths related to COVID-19 reported to Alberta Health in the past 24 hours. I know this is a difficult time to grieve, and my deepest sympathies are with the families and friends of these individuals and everyone else mourning the loss of a loved one from any cause right now. I also want to recognize everyone with a loved one in hospital or an outbreak setting or who's been impacted by COVID-19 in any way. This virus impacts all of us. In schools, there are currently active alerts or outbreaks in 393 schools, about 16% of all schools in Alberta. Currently, these schools have a combined total of 1,453 active cases. This number includes 207 schools with outbreaks, including 92 currently on the watch list. With the calendar flipping to December today, I know many people across the province are starting to plan for the holiday season. For many of us, this upcoming season is about socializing and spending time together. December is when we typically spend time with family, friends, and colleagues. Potluck lunches at work, school performances for kids, gatherings in friends' homes, and big family dinners. It's been a long, hard year, and I know how important these holidays are to Albertans. But in a year that is anything but typical, how we celebrate won't be typical either. We don't yet know exactly what restrictions will be in place during the last week of December. Cabinet will make those decisions later on this month. However, in the past, we have seen holiday gatherings lead to increases in cases and outbreaks as one case spreads to many. For example, Thanksgiving gatherings were an accelerator of spread, and the impact is still being felt. The bottom line is that it only takes one person to start an outbreak. The higher the rate of community transmission, the more risky these gatherings can be, and our transmission is higher than ever before. I know it is challenging to make plans as we wait to see what effect the measures announced last week will have and what will come next. Right now, though, I am encouraging Albertans to begin preparing for a much different holiday season and to start thinking of creative ways to celebrate safely. This is not going to be the year for in-person office parties. This is not going to be the year for open houses or large dinners with friends and extended family. If you are making holiday plans, it is best to assume that you will still be limiting contact with anyone outside your household as much as possible, and that any larger get-togethers will likely need to be virtual. This will be the year for getting together remotely, or having small outdoor activities where everyone can keep their distance. Celebrating virtually or with members of your own household pose the lowest risk for spread. Although this is hard, there are some silver linings to trying out non-traditional ways of coming together. In my own family, celebrating Easter virtually meant that we connected with family members in many places around the world, not just those who could come to an in-person dinner. Of course, the options we will have for the upcoming holidays depend on what we all do right now. The actions we take now and over the coming weeks will determine how the virus is spreading when the holidays arrive. We all have the power to collectively bend the curve, and it will take all of us to do so. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you please put through the first caller?
First is Kevin Nimick with CTV Calgary. Go ahead, Kevin.
Hi, Dr. Hinshaw. The Calgary Airport and Coots border testing pilot program has been in place for 1 month as of tomorrow. What's the percentage positivity rate of people who have used the service, and have returning travelers led to any outbreaks?
That's an excellent question. I was just looking at that the other day, although I don't have the precise numbers in front of me, so we'll have to get back to you with the precise numbers. But the positivity has been quite low. We have reached the number of 10,000 travelers coming through, and the positivity rate, again, has been quite low. We'll get you those specific numbers. Now, in a media availability a week or two ago, someone did report transmission from a traveler. Again, that's not something that I've seen or that's been reported to me. But at the same time, we'll make sure that we are tracking those cases of people coming in. I am not personally aware of any outbreaks that have been caused by someone who's been a returning traveler. But of course, if that were to happen, then we would absolutely share that information.
Operator, could you put through the next caller, please?
Yes, next is James Keller with the Globe and Mail. Go ahead, James.
Hi, Dr. Hinshaw. We've had some data from AHS's early warning system come out today, and there were some numbers out last week in the media. We're tracking ahead of the worst case scenario or the high level from just a week ago, and the projections are getting worse. So what are you expecting in terms of a worst case scenario for ICU admissions as we head into the second wave? And you specifically address concerns about double bunking ICU patients, which we hear is happening at the U of A hospital.
We have been concerned about the trajectory in our healthcare system impact from COVID-19 for some time. That is, of course, why we have been introducing measures, and the most recent, the stringent measures that went in place last week. With respect to how we're tracking on that curve, again, the work that we've been doing with Alberta Health Services to make sure that the system is prepared should those cases continue to rise is an important part of preparation. But the question of whether we track on that high, medium, or low line, that really is in the hands of all Albertans. If we can all minimize the number of close contacts we have every single day, that is what will bring that curve down. With respect to double bunking, we did have yesterday the Dr. Zegan here from AHS, who was explaining that particular process or option is something that AHS has in their contingency planning. My specialty is not critical care, so I would not be able to comment on the details of that double bunking, but what I would say is that for some time, I have been concerned about the trajectory and about the impacts to the system, which is, of course, why I have been making recommendations to put interventions in place that will bend the curve. And now it's up to all of us to make sure that we bend away from that high projection and back down to a lower number of total cases, which will result in a lower number of cases in acute care and ICU.
Operator, could you put through the next caller, please?
Next is Jesse Weisner with Global News. Go ahead, Jesse.
Hi, my question was actually answered. Thank you.
All right, Operator.
All right, then our next question is Sammy Hudez with Post Media. Go ahead, Sammy.
Hi, Dr. Hinshaw. Yesterday you mentioned briefly that you recently met with continuing care operators and staff to discuss the growing number of outbreaks. I'm just wondering if you can shed more light on that meeting and what was discussed. What are operators asking of the province right now as they cope with rising cases, and what options are available when it comes to tighter restrictions at these facilities?
Sure. I will say that the conversation at those meetings was certainly an opportunity for us to hear from continuing care operators what they felt was working well and where we could help and assist with additional supports for operators to make sure that the residents of those facilities are safe and that their staff are supported. There was some discussion about perhaps some confusion, so this is a good opportunity to make sure that I'm being clear about my expectations. We have not changed our overall visitor guidance for long-term care. However, what I did do several weeks ago was I did send a letter to all continuing care operators across the province, asking them to take this opportunity to look at their specific sites visitor plan, and in places like Calgary and Edmonton where we are seeing increased rates of spread, that they take the opportunity to consider whether they may want to limit the number of visitors to just those designated support people for each of their residents at this time. And so again, when we released our updated visitor recommendations in July, what we wanted to do was to allow operators to have conversations with their residents, with family members, with their staff, to be able to utilize information about the wishes of those individuals as well as the context that those sites are located in. And so there was a concern expressed that when I sent that letter, that I wasn't at the same time making sure that the public was aware that this was my recommendation. So that was one of the conversations that we had, was the importance of making sure that we're being consistent and clear, and that the recommendation, although we haven't seen significant spread from visitors into continuing care, that risk does get higher as community transmission increases. So I will repeat something I said, I think, last week with respect to if you have a loved one in continuing care and you are not one of their designated support people, consider whether there's other ways of providing support to that person now, especially if you live in an area where there is increased community transmission. We also talked about the importance of supporting staff and the fact that staff who work in these facilities have been working very hard for a very long time, and making sure that we are providing all the resources that are needed with respect to training, with respect to thinking about ongoing conversations with the operators.
Operator, could you put through the next question, please?
All right, next is Dean Bennett with the Canadian Press. Go ahead.
Oh, thanks. I'd like to follow up on James Keller's question, the projections that we saw. Correct me if I'm wrong, but I think they came out, or they were made post the Premier's announced changes, health restrictions and schools, that sort of thing. So my question is, do these numbers, i.e. 775 hospitalization, 161 ICU, do they reflect, are you taking into account the restrictions and the impact they might have, or is this worst case scenario without the restrictions?
The AHS projections, is my understanding, because my understanding is those projections you're referring to are the AHS operational projections that simply take into account the number of cases that we're actually seeing and the trajectory out should we continue to see the same kinds of growth trends. So again, that really is based simply on actual numbers within that calculation if nothing were to change, looking at that worst case scenario. So those projections do not take into account the impact of changes, and of course that is exactly the point of those restrictions that were announced last week, is to prevent us from hitting those high projections, because what we need to do is to bend that curve down.
Operator, could you put through the next caller, please?
Yes, next is Fletcher Kent with Global News. Go ahead, Fletcher.
Hi, Dr. Hinshaw. I just wanted to ask a few more questions just about the plans for Christmas that you were talking there as well. Understandably, that the cabinet is going to be making those decisions, but what kind of benchmarks would you be looking for, giving to them in your advice when making those decisions? How well do we have to bend the curve before any of these restrictions might be able to be eased, and how bad would it have to get if they have to get tighter? Do you have any? What are we looking at, and what are you looking at when making those decisions?
One of the things that is a really important metric is looking again at that trajectory of spread. So since we started putting into place restrictions at the beginning of October, starting with voluntary measures and then increasing the stringency of measures over time, we've been watching to see if those measures have been able to bend the growth below 1. So again, that R value, or the measure of how many cases on average each case spreads to. We need to get that below 1 so we actually start decreasing the number of new cases that we have. And so far we had, for a short time, managed to bring it to kind of an even number, an even 1, but unfortunately it has gone up again since then. And so that's one of the key pieces that we need to look at, is actually starting to see a decrease in our overall number of new cases, not just a holding steady. So that's one of the things that we're looking at closely. And of course, the number of new daily cases is obviously the important partner to that metric. So bringing down the number of new cases and bringing it down in a way that indicates that restriction in growth can continue over the coming weeks.
Operator, could you put through the next question, please?
And next is Trevor Howlett with CBC. Go ahead, Trevor.
Hi, Dr. Hinshaw. My question is actually sort of a follow-up to that last question. It's about the reproductive number, or the R value. Just wondering if it's possible to get the latest numbers for the province as well as Calgary and Edmonton, since we know that's being used as the key metric. And also just wondering your thoughts on what the Premier did say about the R value being that key metric and determining whether the current restrictions will be lifted in a few weeks. Thanks.
So unfortunately, again, I don't have the most recent numbers in front of me, so we'll have to get those to you. The R values that I have been watching over time, again, we haven't since, and I can't remember the exact date, but it's probably at least a month ago that we'd even managed to hit an R value of 1, indicating we were holding steady. So we are continuing to see growth. And we wouldn't expect to see the impact of the measures announced last week until later this week at the very earliest. So I wouldn't expect that right now we would be seeing an R value below 1. Again, we'll have to follow up and get those specific numbers to you. I think, as I said, that is one of the most important metrics right now, because it does help us understand whether our actions are decreasing the curve enough to actually have that reduction in number of cases, because that is the only way that we are going to be able to alleviate the pressure on the healthcare system. Even if we manage to get R to 1 and just hold steady with our number of cases, we would still see the current impact and pressure on the healthcare system. And then there was there were 3 questions there. What was the last one?
Operator, could you unmute the podium and we can do a little more follow-up?
Yeah, go ahead, Trevor.
Basically just about what do you think about using that R value as the main metric in determining whether the restrictions will be lifted?
Oh, okay. I think I've answered that, so hopefully well enough, but that was my answer to that question. Sorry, I thought there was one more.
Operator, could you put through the next caller, please?
All right, next is Audrey Naveau with Radio Canada. Go ahead, Audrey.
Hi, Dr. Hinshaw. I see that the St. Thomas Health Centre has been added to the list of outbreaks and that there was 1 death there. Can you tell us how many people are infected at the St. Thomas Health Centre in Edmonton?
I don't know if I have that on my list. We may have to get back to you with that answer. I'm sorry, I don't have that in front of me.
Audrey, we will follow up offline with that exact data. We've got time for 3 more questions. Operator, could you put through the next one, please?
All right, we've got Rafi Boudjikanian with CBC. Go ahead, Rafi.
Thanks very much. Hi, Dr. Hinshaw. I'm curious about what happened to schools and the idea that at some point we were told they're not serious vectors for transmission. I believe I had asked you and Premier Kenney about that on November 12th. And obviously here we are about a couple of weeks later, and high schools are shut down until January 11th for in-person learning, and it looks like other grade schools will also be closed until January 11th in person. So is there any kind of research that has changed your assessment of what's going on in schools?
One of the considerations as we were discussing the options for how to respond to rising community transmission was the consideration of how the mechanisms that we were using to make sure that schools did remain a place where we were not seeing transmission, and that being quite a aggressive policy of excluding those who were in the same class as a case who attended school while infectious, and the impact that was having on students' learning and on the ability of the schools to provide that ongoing educational program. So we were seeing that for every case that we had in a school, there were many, many students who ended up being at home for 14 days. And as we saw community transmission increase, we saw that happening in more classes. Sometimes a class would have to be off and then back in and then go off again. And so part of the decision with respect to school closures was for planning purposes, for the ability to really have the schools be able to plan that educational program without that in and out version of things that we were seeing become more and more frequent. We are also seeing that the students in junior and senior high, because we know that older ages can transmit more effectively, or I should say more similarly to older adults, whereas the younger children in elementary school don't seem to transmit as easily, that those were the ages where making the decision to have those students at home and learning remotely for several weeks was, again, part of that package, partly, again, because it helps to provide that additional stability, and partly because those are the students who can transmit more than the younger students. I recognize that this does have an impact on students even in the older grades with respect to their learning, but the planning behind this, again, is that we provide this period of stability, and then after the break, and you mentioned that 1 week after the break, and that week really is targeted at if there are gatherings that happen over the holiday season, over Christmas and New Year's, and if there is transmission that happens, providing that break after those holidays makes it less likely that we see many transmission events spilling over into schools from whatever happens with respect to transmission in the holidays. So it's meant to help schools have a bit of a buffer between the transmission events that may happen in the holidays and when school restarts in person again.
All right, operator, could you put through our second last question?
Aaron Collins with CBC National. Go ahead, Aaron.
Hey, Dr. Hinshaw. Thanks very much for taking my question. Some provinces across the country, Ontario, Quebec, BC, have set a date for when they hope to be ready to receive and distribute vaccines, start immunizing people. For Ontario, at least, that's the end of the month, end of the year. And I'm wondering if here in Alberta we've set a date for when the province hopes to be able to roll out a vaccine, assuming, of course, that there's one ready for us then.
We've been planning for several months for the ability to start immunizing, and we're working with the federal government to determine when those first shipments of vaccine are expected. And part of the reason that we haven't, again, set that date is that we're not sure yet exactly when that vaccine will start arriving, but we are aiming to be able to provide vaccination when vaccine is available. And so I can assure you that the planning underway is robust, and that we will be ready when vaccine is ready.
All right, operator, could you put through the final question, please?
Final question is Duncan Kinney with the Progress Report. Go ahead, Duncan.
Hello? Hello.
You're on. Go ahead.
Hello, Dr. Hinshaw. Thank you for taking my question. There was a report online the other day from the group Support Our Students saying that 21 children from Alberta schools had been hospitalized due to COVID-19. Can you confirm that that number is in fact correct, and perhaps talk about why that number hasn't been proactively disclosed?
So that's a number that I'm not familiar with. We'll have to take that away and look at our data. We do make the number of hospitalizations by age group publicly available, and that is on our dashboard. So if you're looking at the data tab on the alberta.ca/COVID website, the data tab under severe outcomes will show you by age group how many individuals by age have been hospitalized, how many have been admitted to the ICU, and how many have unfortunately passed away. And so I'll have to go back and ask the team, but that's not information in terms of those who attended school or did not attend school that I have. But we certainly, again, make available publicly all hospitalizations by age group, and I'm not sure if that's potentially that school-age children, perhaps that's where that number is coming from, but we'll take that away and make sure to get back to you. Yeah.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe night.